Hi, I'm Dr. Joe Niamtu, LoveThatFace.com, and thank you for subscribing to our channel. We are working on 20 million hits, and we appreciate your time. As you know, I do cosmetic facial surgery in Richmond, Virginia, and my favorite procedure is facelift, but I do everything from here to here. And I like to talk about a little segment I call a great little case. And this is just a little showcase of some cases that we have done that I thought had excellent outcomes, and I can show you what the patient had and what we did. So today's great little case concerns blepharoplasty or cosmetic eyelid surgery. So we're going to go over some clinical cases. I'm going to show you some eyelid cases. And again, I'm really a lucky guy because I love doing cosmetic surgery. And as I've said, facelift and eyelid surgery are my favorite procedures. And when I go to bed on Sunday night, I'm really pumped up about coming in Monday morning and getting to do surgery. And again, all I do is head and neck surgery, so I don't do any boobs, bellies, and butts. So let's look at this patient. She presented to the office with the chief complaint of eyelid aging, and we performed upper eyelid surgery, lower transconjunctival blepharoplasty with internal incisions, so you can't see any incisions. And then we performed laser resurfacing of her lower lids. I think you can see the difference. We took off all of this extra skin and muscle and fat. And in the after picture, you can see she has a nice shelf here. On the lowers, we got rid of this bag and tightened up some of that skin. And here is another before and after picture of the other side. So great case. It's surgeries like this that really make patients happy. And this is the patient looking upward. And the reason we look upward in a before and after picture is it accentuates these fat pads. And you can see that we've gotten rid of this. And again, very happy patient. So here's another case, same thing. Patient just looks tired, and people come in and they say, "Hey, Dr. Joe, my friends are asking me if I'm not getting sleep or if I need a vacation." And there's no doubt about it that the excess tissue in the upper and lower lids makes us look older and tired. So in this case, you can see the tissue that the patient had, the extra skin and muscle and fat in the upper lids. And after her surgery, she has a more youthful upper eyelid complex with a nice visible shelf, and that shelf is important, and that's what women use to put on makeup, etc. Her lower lids, before surgery, she had these bags and wrinkly skin, and you can see that after surgery she looks much better because we've reduced that. Now again, I don't use external incisions, so I make all my incisions inside the eyelid, and we don't cut skin away. We laser the skin to make new skin. This is the same patient. So if you notice that she had no shelf, and now she has a very nice defined shelf. And again, looking at her lower eyelid bags before and 90 days after surgery. This is the same patient, and it is the left side. So we've already talked about these positive changes. This is another patient before and after surgery. You can see same thing. All these cases are very similar in that the patients had excess upper skin and it touches their eyelashes, and after surgery they have this nice shelf here. And again, the lower lid bags, which we've taken some fat out from the inside of the eyelid and lasered the skin. Same patient from the other side. And you can see that patient had no shelf. Now she has a nice shelf. You can see that the patient had bags and wrinkly skin, and now she doesn't. This is another case. Now this is a little bit younger patient. And again, some people, it's hereditary, and they'll come in their late 30s or early 40s. And this patient had skin that touched their lashes, which is generally a sign that you may need your upper lids done. And we took off these little moles and took out some fat and lasered the skin, and you can see the after result. Same patient. This is the right eyelid close up. You can see the nice shelf that we have made, and that we have cleaned up the skin, gotten rid of these moles, and tightened the skin up with the laser. This is the same patient from the left side. Here's a male patient, and all these are basically the same situation. You have extra skin, muscle, and fat on the upper, and lower lids that have fat protrusion. And you can see the before and the after surgery. Again, we don't make any external incisions, and what we are doing is taking out the fat from the inside and lasering the skin. And here's the same male patient. There's the excess skin before and after. If you look at the lower lid, you can see the bulging fat and the wrinkly skin, and you can see the improvement. Again, no incisions that are visible on the lower lid, all done from the inside. That's called the transconjunctival method, and I have numerous videos on that. So again, male patient, same thing, no shelf, shelf, fat bag, wrinkly skin, now rejuvenated. And here's another patient, female patient. So this is just showing the amount of aging that we get, and it really makes us look old and tired, especially the lower lid fat bags. So this is a patient before, and 90 days after. You can see that we had no shelf. Her skin was touching her lashes. Now we have a nice shelf on the upper lids. On the lowers, we had these large fat bags and wrinkly skin, and we lasered this area and recontoured, reduced some of the fat, and it gave us that result. This is the same patient from the lateral view. So you can see the improvement on the upper and the really nice improvement on the lower. And I'll tell you, as a cosmetic surgeon, when you look at your before and after pictures, it gives you such a great feeling to know that you help somebody like this. And it really makes my job worth it. And here's the left side. And it's not uncommon for people to have all this extra skin and fat on the bottom. So that's before and after upper blepharoplasty, lower lid transconjunctival blepharoplasty, and CO2 laser skin resurfacing. And also, I only use laser technology for my incisions, so I don't use scalpels or scissors. Here's the patient looking up. And when you use lasers instead of scalpels or scissors, you have virtually zero bleeding. And when you have less bleeding, that means that you have less pain, less bruising, and a faster recovery. Here's a male patient. This is lower lids only. And you can see the improvement here of the lower eyelids, and also we took off that mole. Same patient looking upward, illustrating the presence and the lack of fat pads. And here's another young patient, all right? And again, some of these patients, their skin starts to touch their lashes, and it's a hereditary situation. So upper and lower lids with lower lid laser before and after. That's the lateral right side, showing the before and the nice shelf after, and the improved lower lid here on the right in the post-op picture. So the left is before, the right is after. Same patient, before and after. Look how much we've improved this redundant skin, muscle, and fat over here in the after picture. And again, this patient didn't have severe lower aging, but she had enough where we did take a little bit of fat and lasered the skin. Again, another case, and these are kind of all the same technique. This is my bread and butter technique of upper lid with the laser incision, lower lid through the inside of the lid, decrease some of the fat, and laser the eyelids. Before and after, before and after. Thank you so much for the greatest gift of all, which is your time. I'm Dr. Joe Niamtu, cosmetic facial surgeon in Richmond, Virginia. We see many out-of-state and international patients, and we're set up to make it safe and easy for your surgery. Our goal is safe surgery with natural and predictable outcomes. Again, thank you so much for your time.